Attorney General Platkin has publicly criticized New Jersey's handling of opioid settlement funds. Can you outline what prompted this scrutiny and why it's significant right now?
Certainly. The state has received over $1 billion from lawsuits against opioid manufacturers. AG Platkin argues that these funds are not being allocated transparently or effectively, especially as opioid overdose deaths remain high, with more than 30 fatalities reported in New Jersey last year.
That's a staggering number. How does Platkin say the funds are being mismanaged, and what exactly is at stake for communities affected by the crisis?
Platkin alleges that much of the money is diverted to administrative costs or non-addiction-related projects. He fears that without clear oversight, these resources won't reach local treatment centers or prevention programs where they could save lives.
Before we delve deeper, could you break down where these opioid settlement funds are coming from and how they're intended to be used according to state agreements?
Absolutely. The funds stem from multi-state legal settlements with companies like Purdue, Pharma, and Johnson & Johnson, who were found liable for their role in the opioid epidemic. These settlements typically stipulate that the money must go toward remediation efforts. Think addiction treatment, education, and harm reduction.
So, by design, these funds aren't meant for general state expenses. Do other states face similar challenges with proper allocation?
Yes, several states have faced criticism for misdirecting funds. For example, a ProPublica investigation found that only a fraction of settlement dollars nationwide directly supports addiction services. This pattern raises concerns about broader accountability.
Platkin's central criticism seems to revolve around transparency. Can you explain what specific mechanisms he says are lacking or failing in New Jersey's oversight process?
He highlights the absence of public reporting on spending decisions and limited community involvement. While a state advisory council exists, minutes and funding details aren't regularly published. Platkin warns this opacity could breed misuse or even corruption.
That's a serious allegation. How do state officials respond to these claims? Do they acknowledge the transparency gap?
Some officials admit improvements are needed, but argue that legal and logistical hurdles have delayed full disclosure. They point to ongoing efforts to create a centralized tracking portal, but advocates say progress is slow.
Let's transition to accountability. What systems area should be in place to ensure settlement funds are used as intended?
Ideally, an independent oversight board would audit spending and publish regular reports accessible to the public. Some jurisdictions even involve affected families in decision-making. However, New Jersey's current approach lacks these robust safeguards, according to Platkin.
Are there concrete examples from other states where stronger oversight led to better outcomes?
Yes, North Carolina established a public dashboard tracking every dollar spent, which has helped direct more resources to high-risk areas. Their overdose rates have stabilized as a result, suggesting transparency can drive targeted action.
Platkin also mentions that a substantial portion of funds is being spent on administrative expenses. Could you quantify this and explain the implications for frontline services?
Reports indicate that up to 20% of New Jersey's opioid settlement expenditures have gone to overhead far above the 5–10% many experts recommend. This diverts millions away from treatment programs, naloxone distribution, and recovery support, potentially diminishing the impact on the opioid crisis.
Why does administrative spending climb so high in these cases?
Complex grant applications, legal compliance, and fragmented oversight can inflate costs. However, advocates argue these processes need streamlining to maximize dollars reaching those in need.
Let's discuss the real-world impact. How are these funding decisions affecting addiction treatment and prevention efforts on the ground in New Jersey?
Several clinics report waitlists growing, with some unable to hire enough staff or expand services due to funding shortfalls. Prevention campaigns, such as youth education and safe disposal programs, receive inconsistent support. The ripple effect, according to community leaders, is more overdose deaths and relapses.
Are there examples of programs forced to cut back or close entirely?
Yes, a major Newark recovery center recently announced layoffs after promised settlement grants were delayed, illustrating the tangible human cost of misallocated funds.
Another key issue is community involvement. How much say do local stakeholders currently have in determining how funds are spent?
Unfortunately, community input remains limited. While the state holds periodic listening sessions, decisions largely occur behind closed doors. Platkin and advocacy groups argue that those directly affected families, health workers, and survivors should have a far greater voice.
What difference could broader stakeholder engagement make?
Inclusion can lead to more tailored, culturally competent interventions. For example, tribal nations that managed their own opioid settlements saw improved outcomes by funding culturally specific healing programs.
Zooming out, how does New Jersey's handling of opioid funds compare to national trends? Are we seeing similar patterns elsewhere?
Nationally, misuse and lack of transparency are unfortunately common. A 2023 Johns Hopkins review found that only 37% of states publish detailed opioid fund spending reports. New Jersey aligns with this trend, but the public pressure here may catalyze reforms.
So, is there a model state or gold standard for others to emulate?
Maine and Colorado have earned praise for participatory budgeting and transparent dashboards, offering potential blueprints for New Jersey to adopt.
Given these challenges, what solutions or policy changes is AG Platkin proposing to improve stewardship of opioid settlement funds?
Platkin advocates for mandatory public reporting, independent audits, and a cap on administrative expenses. He also supports a state-run portal for real-time tracking of disbursements, similar to those adopted in other states with positive results.
Are there legislative efforts underway to codify these recommendations?
Yes, several lawmakers have introduced bills to formalize transparency and accountability requirements, though debates continue over the exact structure and enforcement mechanisms.
Finally, let's consider the long-term stakes. How might continued mismanagement of opioid settlement funds affect public trust and health outcomes in New Jersey?
If these issues persist, trust in public institutions could erode further, making future public health initiatives harder to implement. More critically, the ongoing opioid crisis could worsen, with projections suggesting thousands more preventable deaths unless funds are directed effectively.
To wrap up, what's the broader lesson for other states managing similar settlements?
The key takeaway is that transparency and community engagement are not just ideals, they're practical necessities to translate historic settlements into real-world recovery and prevention gains.